Hey there, and welcome. So, pregnancy is this incredible journey, right? But let's be honest, it can also come with a whole lot of questions. Today, we're going to break down 5 of the most critical health checkpoints in prenatal care. We're getting into the why behind what your doctor recommends so you feel totally in the loop. I mean, from books and blogs to what feels like every person you've ever met, the amount of information coming at you can feel like a tidal wave. So think of this as your life raft. We're just going to cut right through all that noise and focus on 5 key health checks that will help you feel confident and, honestly, empowered. Let's think of this as our roadmap. We've got 5 essential questions that are going to act like big, bright signposts on your pregnancy journey. Each one is a key checkpoint to make sure everything's on a healthy path for both you and your baby.
Okay, let's jump right in. Our first checkpoint happens pretty early on, in the first trimester. This is when so much is happening. And, as you're about to see, timing is absolutely everything.
So, here's our first question for you. When is the best time for that first trimester screening? You know, that early, non-invasive check that looks at the baby's development. Are we talking A, 6 to 8 weeks, B, 9 to 10 weeks, C, 11 to just under 14 weeks, or D, 15 to 18 weeks? What do you think? And the answer is C, between 11 weeks and 13 weeks and 6 days. Hey, if you got that right, awesome. But if not, don't even worry, because the reason for this super specific window is what's really fascinating. And here's why that timing is so crucial. Before 11 weeks, the baby is just too tiny for anyone to get accurate measurements. But if you wait too long, past 14 weeks, a key physical marker that they look for becomes unreliable. So that little window, that's the sweet spot. It's when the physical measurements and the blood work line up perfectly to give the clearest possible picture. Okay, let's move on to our next checkpoint, which is all about protection. Seriously, one of the best things you can do to keep your baby healthy is to keep yourself healthy. And that's where vaccines come into play. So, question number 2. Out of these common vaccines, which one is generally a no-go during pregnancy? Is it A, the Tdap, B, hepatitis B, C, the inactivated flu shot, or D, the MMR vaccine? Take a second to think about it. The correct answer is D, the MMR vaccine, which covers measles, mumps, and rubella. And this brings up a really important difference between the types of vaccines out there. You see, the MMR vaccine is what's called a live attenuated vaccine. That means it has a tiny, super weakened version of the living virus in it. Now, this is fantastic for building a really strong immune response. But during pregnancy, there's a theoretical, and I mean very small risk, that it could cross the placenta. So, just to be extra safe, doctors avoid it. And this slide really lays it out clearly. The recommended vaccines, like Tdap and the flu shot, are totally different. They're made from killed viruses or just little pieces of them. They literally cannot cause an infection, which is why they're not just safe, they are strongly recommended to protect both you and your baby. All right, checkpoint number 3. Right around the middle of your pregnancy, your doctor's going to check for something called gestational diabetes. It's just a temporary type of diabetes that can pop up during pregnancy. And you know what? It's really common and totally manageable. Which leads us to our next question. What is the gold standard, the absolute best test for checking for gestational diabetes? Is it A, a random blood sugar check, B, an HbA1c, C, the oral glucose tolerance test, or D, a fasting glucose test? And if you guessed C, the oral glucose tolerance test, or OGTT, you are spot on. Yep, this is the famous one with that very sweet drink you've probably heard about. And there's a fantastic reason why it's the go-to method. This table just breaks it all down. See, pregnancy hormones can actually mess with how your body normally handles sugar, and that makes other tests a bit unreliable. But the OGT is different. It's basically a stress test for your system. It gives you a specific amount of sugar and then measures exactly how your body responds. It's the only one that gives such a clear, direct picture. Our next checkpoint is all about staying one step ahead of any potential issues. These routine screenings are designed to catch common complications way before they become serious problems. Prevention is totally the name of the game here. So, let's talk about something called a silent UTI. Basically, you can have the bacteria for an infection without any symptoms. So what's the biggest risk if something like that goes untreated? Is it A, a bladder infection, B, a kidney infection, or C, preterm labor? And the answer is B, pyelonephritis. That's a serious kidney infection,
And it's exactly what those routine urine tests you do are designed to prevent.
This slide shows exactly how that can happen. It starts silently, with just bacteria in the bladder. But because of all the changes happening in your body during pregnancy, it's actually easier for that bacteria to travel up into the kidneys. A simple urine test and maybe a course of antibiotics can stop this whole process right in its tracks, preventing a much more serious illness. Okay, one final common issue that doctors screen for is anemia, which can make you feel super tired. And as this quote from the experts points out, the #1 cause of anemia during pregnancy is a lack of iron.
I mean, just look at this chart. That massive slice tells the whole story, doesn't it? Iron deficiency is by far the main reason. And it makes perfect sense. Your body is working overtime, dramatically increasing your own blood volume while also building your baby's entire circulatory system from scratch. The demand for iron just skyrockets. So, to wrap up our journey, here it is, your 5 key takeaways. First, timing is everything for that initial screening. Second, vaccinate wisely. Know the difference between safe and not recommended vaccines. Third, trust the OGTT. It's the gold standard for a reason. Fourth, screening prevents sickness. Those simple tests are powerful. And finally, iron is absolutely essential.
And we'll leave you with this final thought. Knowledge really is power. Now that you understand the why behind these checkpoints, you're not just a passenger, you're an active partner in your own healthcare. So, the big question is, what are you going to ask at your next appointment?